There's three main components to full lung function testing. So that's spirometry, which we talked about earlier, lung volume testing, and diffusing capacity. So spirometry, as we mentioned, is that one where you blow into the machine as hard as you can for as long as you can, and you repeat that 2 or 3 times. And then the lung function technician will get you to inhale a bronchodilator, and they'll repeat that again. So that will show if there's any reversibility in bronchoconstriction, and that helps us to diagnose asthma. The next component is the lung volume testing, and that's done by sitting in a box in the lung function lab that looks a little bit like an old telephone booth, and that box has got a known volume, and so we can tell how much air is displaced when they go into the box, and we get to do some breathing techniques, and that tells us a lot about how much air is in the chest, but not only is what their total lung capacity is, but different breakdowns of that. And you remember that graph where there was tidal breathing, a line going up and down, and then someone breathed all the way in to the total lung capacity and then all the way out down to residual volume. And there were all of these capacities that you were supposed to remember for exams. They matter a lot because those different breakdowns of the lung volumes are very important. If you've got something like chronic obstructive pulmonary disease, where the smoke has destroyed the elastic tissue in your lungs, and your lungs have lost that elasticity and they've become hyperinflated, then you've got a lot of air stuck in your lungs, but it's really hard to get it in and out. So your functional residual capacity, which is the air left in your lungs after the end of a normal breath, it becomes a lot higher. And that means that you're breathing with a lot of air in your chest, which is really inefficient. And that makes the work of breathing really hard. And if you exert yourself, you can't get all of your air out before you need to take another breath in. So it gets worse and worse. That's called dynamic hyperinflation. So that's something that we can see on lung volume testing. That third component of lung function testing is diffusing capacity or gas transfer. And that really is a measure of how well oxygen is getting from the alveolus across the alveolar membrane into the blood vessels, and how well carbon dioxide is getting from the blood vessels out into the alveoli and then breathing that back out. And that test will be impaired in many lung diseases, but especially interstitial lung disease.